South Dakota Republican John Thune. So, Senator, if you had to handicap this now, given this latest information, we have a very respected federal agency saying this doesn't add up, how would you handicap the potential for health care passage at all?
It undermines the entire premise for doing this, Neil, which is to lower the cost of health care. That's what reform was supposed to be all about. And the president has said that he's not going to sign a bill that adds to the deficit or increases health care costs. Well, every study that's come out, both government studies and independent studies, have indicated that the proposals that have been put forward, and of course the most recent version of that is the 2,200-page House bill, would actually increase the cost of health care in this country, both as a percentage of GDP and, of course, to individuals in the form of higher premiums. Those to me are elements about this whole debate that I think are starting to sink in with the American people, and I think it's going to complicate passage in the Senate, but it's not going to stop them over here from trying to rush this thing through. They're trying to put it on a fast track just like they did in the House so that they can get this thing passed before the American people have a good opportunity to see what really it includes.
Well, when you say on a fast track, in other words, a vote and get this to the president's desk before the Christmas break?
Well, I think what's going to happen, Neil, is they're going to try this week to have a CBO score, and the leader, Harry Reid, I think, is going to try and move what they call a shell. It won't be the actual House bill because Republican or Democrat senators don't want to have a motion to proceed on the House bill. A lot of them don't want to vote for the House bill. So they'll put something on the Senate floor, and then he'll substitute in his language, which we haven't seen yet. We haven't seen any CBO score of it yet. And he'll try and be on the bill the day after the Thanksgiving break and then use the Christmas as a backstop to ensure that it gets done. And they're threatening to keep us here over the Christmas holiday. And I guess what I would say to that is, fine, we'll be here. If it means stopping this monstrosity, this $3 trillion expansion of the federal government, Republicans are more than happy to stay here through the holidays if that's what it takes to stop this thing.
What, Senator, if they come back and say, we'll do this the reconciliation route, in other words, needing only a simple majority than the 60 votes needed, which would be precedent breaking, then what happens?
I think that complicates things for them. I think that probably pushes this back into next year. And I think once you get into next year, to get into an election year, a political year, I think what they want to do is figure out a way to get this done before the end of the year, at least through the Senate, so that they can then go to conference and hopefully wrap up deliberations early next year and put a bill on the president's desk. But I think using reconciliation, which, as I've described before, in this circumstance would be an abuse of legislative power. It was certainly not designed to do something this consequential. And maybe that's what they're left with if they can't get 60 votes for this. But if they can't get 60 votes, it means that there are Democrats in the Senate who won't vote for this monstrosity. And that's certainly what we hope is going to happen. We hope there are Democrats that are going to come to their senses and say, this is not something we want to be a part of, in which case the leader may have to fall back on using this expedited reconciliation process.
Senator, thank you very much.
Thanks, Neil.